Hi everybody, it's Dr. Rahul here from YourGPCircle. Hope you're all doing great. So today I just want to focus on some other lifestyle factors which will have a significant impact on diabetes and also the risk of you developing heart disease, because diabetes and heart disease have a very strong link. Now, in fact, in the age group of 65 and above, and probably even younger maybe, patients with diabetes actually don't end up suffering problems and complications or dying even because of the diabetes. They actually die because of heart attack. So heart attack is the #1 leading cause of death in patients with diabetes above the age of 65. So as well as controlling the blood sugar in the diabetes, it's very important that you control the other factors which may put you at risk of heart disease and heart attack and stroke as well. So those risk factors, very broadly speaking, are #1, smoking. So reducing or stopping your smoking is the #1 thing that anybody can do to improve their health or to reduce the risk of them developing complications in future life. So stopping or reducing smoking will drastically reduce the chance of you having a heart attack or a stroke. #2, alcohol. So ensuring that your alcohol consumption is within the recommended limits. So the current recommended limits for men and women is 14 units per week. So 14 units per week. Now I'll put a link down below once again, just explaining what a unit of alcohol is. #3, doing some regular exercise. So I mean the recommended amount of exercise by the World Health Organization is 5 times a week. For about half an hour at a time, to make us sweaty, a bit short of breath, to really kind of get the heart racing. But obviously that can be quite difficult to do for many of us. I certainly don't. But any exercise, even if it's once a week, really will reduce the risk of you having a heart attack and stroke, because doing exercise will in turn help your weight and help you to maintain a healthy weight, and can also help to lower your blood pressure as well, which once again is a risk factor for heart problems, especially if you've got diabetes. And one other really last important point is about cholesterol. So cholesterol is a fatty substance which we've all got. We all have it in our blood and our body, and we do need a bit of cholesterol for our body to work. However, the problems arise is when we have too much cholesterol in our blood or our body. And we normally get too much because of the things that we eat. So we're eating foods which are high in cholesterol. So examples certainly would be fried and fatty foods, because when you fry anything, it naturally becomes higher in cholesterol. But foods can be naturally high in cholesterol as well. So red meats such as pork, lamb, beef, bacon, all of these things, what we call red meats, and they're naturally high in cholesterol. So we would discourage you from eating those things, or certainly only in moderation, on an odd occasion or a rare occasion. And your protein intake or your meat intake should be more focused around chicken and fish, so what we call white meat. So that will certainly help to keep your cholesterol down if you reduce your red meat consumption but increase your white meat consumption. Okay, so there's only a few broad topics there because it really is so much to go into in one video, but just to recap, so stopping smoking, keeping alcohol consumption within the recommended limits, doing some regular exercise, reducing your cholesterol intake and your fat intake through our diet. So like I said, I'm going to drop some links down below which will go into each of these things in more detail and elaborate on them, and I would encourage all of you to have a look at those. And don't try to make drastic changes in all of these areas, because that is really difficult to do. What I would suggest is pick these areas and just identify small changes that you can make in each of these areas, and you're more likely to be able to maintain that over a consistent and persistent period of time. So maybe to reduce your smoking, maybe to reduce your alcohol a little bit, maybe to start going for a walk once a week if you don't go for a walk at all. And you'll find that when you make these small changes, you're much more likely to be able to maintain that over a persistent, prolonged period of time, until after 2 or 3 months you're ready to make some more small changes in that area. So the combined effect of that is much greater, and your chance for success is much greater as well. So I hope that's useful, and we'll see you next time.